Memorial Day weekend of 2015 took an unexpected turn for John Cooley.
I was sitting in our living room watching television at night, and the ceiling started to spin, and I became dizzy and had to vomit.
After John's quick thinking and his wife's call to 911, he was on his way to the hospital. A retired physician with no prior health problems. But within 1 week, John had 3 strokes and a heart attack.
If it's happening to you, it's not easy to process.
While more common the older you get, a stroke can happen to anyone at any age at any time.
It is the leading cause of disability in the United States, and it's the 5th leading cause of death in the United States. Every 40 seconds, someone has a stroke. There's about 800,000 strokes a year in the United States.
When it comes to a stroke, there are 2 factors to keep in mind that could save your life: symptoms and time. The best way to remember: be fast.
It's important to be fast when you suspect a stroke, simply because when the brain is lacking oxygen, that cell can die. And when that cell dies, it's not regenerable. Every minute counts.
Use that acronym to spot a stroke: balance.
If you have any sort of imbalance, an inability to have that coordination just simply walking.
Eyes.
If there's any sort of visual field cut deficit, or if you notice you have some double vision.
Face.
So you have some paralysis in your face, and so that you can look very quickly and notice that it doesn't look normal.
Arms.
If you have any sort of weakness or inability to coordinate that arm.
Speech.
You're having difficulty saying what you want to say, or if all of a sudden you notice you don't understand what people are saying.
And time.
It's really important to call EMS as quickly as possible to get life-saving treatment.
When you call 911, EMS tells the emergency room you're on your way and prepares their rapid response team.
And they get you right to the CT scan to figure out if the stroke is a bleeding type of stroke or a clot type of stroke. The vast majority are clot types of strokes. Then that takes you down a different pathway of treatment, so we can use a clot-busting medication called TPA, and that helps lyse or break up the clot. And this improves outcomes by 1 in 3. So every 3 people who are treated, 1 person's significantly improved. 1 in 8 are cured.
High blood pressure is the single biggest risk factor.
That's something that everyone can kind of monitor and do something about.
Others include diabetes, high cholesterol, and alcohol and tobacco use. Effects vary based on the type, severity, location, and number of strokes.
The left side of my brain was spared, and I can use my right hand, and this left side of my brain is helping my left side learn what to do.
Years later, John is still putting in the work to help himself.
I would tell people, don't give up. Give the person who has had a stroke a hug. That hug says more than your words.
With his support system by his side every step of the way, a positive attitude, his faith, and a lot of hope.
A stroke cannot steal your purpose. If I wake up with a purpose of having joy in my day, I choose to be joyful. I count things, all of this, as joy.
For In Good Health, I'm Whitney Amen.